Now we're good.
Yep.
Thank you
Thank
so
you.
thank you so very much. I always start with my home team. I am so excited to be here with you tonight. I am always humbled and honored that you would share your home time, your evening time to listen to anything that I might have to say. This is my disclaimer because I have the most wonderful job in the world, but this is my home team and sort of my credential, my real credentials that I feed these humans as well as the pets that are looking eagerly for their broccoli treat, and they are still alive and thriving. So that's my real street cred, if you will. Let me move this here. At the risk of disappointing you all, I just wanted to give an overview first, and that is that I consider this really part 3, and is sort of what I refer to as the nutrition series. As Will mentioned, there were some others that were given a year and a half ago, and I'll refer to those, and I believe that you'll get an email link if you want to review those or view those for the first time. Tonight, I chose this topic because it's a lot of what I do in my day-to-day practice, and it's really let food be thy medicine and medicine be thy food, because it's the basics of using food for therapeutic management of disease. And I want to clarify what I mean by therapeutic foods. You may refer to them as prescription foods or foods that require a prescription to use from your veterinary healthcare team. I want to also go over some tips for success on how we can really optimize the full potential of these products and how to avoid some pitfalls so that we can keep your pet on the path to health. And then I'll entertain some questions. So again, I just need to give a few disclaimers before we march on, in that I will use photos of labels, pet food labels, and that is neither to endorse or malign any particular product or products. It's merely to show examples of foods. I'm going to be talking about the principles of, again, using nutrition to manage multiple diseases, but I'm not going to go into great detail about specific diseases, or that would be a whole course. I have reviewed your excellent questions, and I have tried to incorporate many of them into tonight's session. But I, as Will mentioned, will not be giving specific recommendations for your pet, because that, again, a prescription product requires a doctor-patient relationship. So it would not be appropriate for me to be making a therapeutic recommendation for your pet. I always start too with my bias. Anyone who talks to you about nutrition has a bias. I do not work for a pet food company. I love my job. I have the most favorite position in the world, because this is what I believe, that nutrition is at the core of nurturing. To feed is to cherish, from the Latin root. And I believe that food is symbolic of love when words are inadequate. And so what I can tell you is that it sounds as cheesy as it sounds. I did not choose the field of nutrition. After I became a veterinarian, I believe the field of nutrition chose me. I have a strong need to nurture. And the way I care for any of the people or the pets in my world when they're ailing is to feed them. And so again, it's the most perfect job. And I work here at the VMC and the College of Vet Med because I love to see patients and treat them, to meet all of you wonderful clients, and to teach all the marvelous students and residents and staff that I work with. So again, my belief is that you are what you eat. Everything that we eat goes into the building blocks that make the foundation of our body and the mechanics of helping our body, the machinery, run. And so, of course, I believe firmly that food matters, and that great nutrition can have a positive impact on the way we feel and the way our health is. So diet, to me, is one of the most important factors that influence health and prevention of disease, but also the management of diseases. And when we feed ourselves and our pets right, it impacts or increases our, not just lifespan, but our health span, the time we have on earth feeling well, thriving, I like to say. And so I want to invite you as part of the team. And so when I am meeting with clients and meeting with patients, nutrition is a team sport. And so I have to take into account not just the pet, but the pet parent and the whole family perspective. Am I recommending affordable care? Am I taking into account cultural preferences, if possible, where you like to shop and obtain your food? And even if I recommend what I think is the most brilliant idea, if the pet won't eat it, it will be a useless plan. So I have to take all of those factors into consideration each and every time I'm making a recommendation for the patients that I see. And I love nutrition because look at all of these areas I've sort of parsed out where I think there's an opportunity for veterinary healthcare teams to implement nutritional care. And really, I could have saved this slide and said all throughout life, because that's my firm belief. The first two webinars in this, what I'm calling a nutrition series, were the 1 and 2, how to proactively prevent diseases and protect health throughout life. I also gave a session on how to make pet food selections, what to evaluate, and then unraveling some of the myths and misconceptions that are out there, because there's so much information out there on the online and in books, and so it's a jungle out there. But tonight's session will be about therapeutic nutrition. So I'm really going to focus in on the concept of using nutrition to manage diseases. I have to take a step back before we take a deep dive into therapeutic nutrition and make the distinction about the way people eat, or the way we feed humans, and the way we feed our pets. It's hard to feed a human, and I have now enough wisdom and age that when I went to school, we learned about the 4 basic food groups. And then those food groups turned into a food pyramid. And the food pyramid was hard to understand. What's a portion size, and how do I work this? And so now we have myplate.gov, and it's strikingly, almost cynically, I look at that, and it's very similar to the 4 basic food groups that I learned. Again, it's hard to make sure that we are getting all of the nutrients that we need as humans. But luckily, it's a wonderful world in the United States in the world of pet nutrition, because it's just a completely different way of thinking when we use the term complete and balanced nutrition. And so the concept of feeding our dogs and cats is to offer a product or products. If your pet eats commercially available food, it is meant to be complete, so it has all of the nutrients that species, whether it's a dog or a cat, they need very different things, and that all of those nutrients are present and they're balanced to the pet's energy requirements. So when we feed the right amount for them to maintain a healthy body weight, all the nutrients are not just there, but they're there in the right balance or the right amount. It's a marvelous thing, so that each and every bite provides all of the nutrients. As opposed to when humans eat, we eat a lot of variety, hoping to heck that at the end of the day, we're going to meet all of our needs. I like to make, I'm a nerd about nutrition. And so what I know is that humans make on average 200 food choices a day. We eat a little of that, a little of this. And we don't eat 200 things, but we might say, oh, the blueberries are in season, I'm going to have a second helping. I need my coffee in the morning. I'll say yes to this, no to that. And so we make 200 food choices. But most humans don't eat complete and balanced nutrition each and every meal. I liken this concept to infant formula, where in those early months of life, the milk, either an infant, so if it's a commercially available product, not nursing, it provides all that little infant needs, and is getting everything in the right amount so that they can grow up good and strong. When we use that concept of complete and balanced nutrition, you can imagine that anything that you add on top of that has the potential to disrupt the balance. And of course, what is life without treats? And so we want to make sure that our pets are enjoying time with us, and many of us enjoy giving our pets treats. But if those treats are not complete and balanced, even if they're very healthy items, they run the risk when it's greater than, on average for healthy pets, 10% of their calories each day. You run the risk of upsetting their intake. But when a pet is ill and they're eating a therapeutic diet, those diets are formulated essentially to be 100% of the intake. Now that's ideal. And then there's real. And so again, we want to make sure that we do have the ability to give some treats, but I want to be the guardian that we're not undoing or undermining the benefits of that very specific therapeutic or prescription diet. So we want to make sure that treats don't exceed 5% when a pet is on a prescription product. Now, I have questions all the time about processed food because it just kind of hurts our heart sometimes at the idea of feeding the same food each and every day. And I understand completely what our worry is about processed food because we were taught to shop around the perimeter of the grocery store. We're supposed to eat fresh food, fresh fruits and vegetables and dairy and all the things that live on the outside of the grocery store, not the inner aisles. Processed foods in human nutrition is sugar, fat, salt. It tends to be snack foods. It tends to be food that is highly preserved for very long shelf life and economics. That very same word processed in veterinary or pet nutrition is completely different. It's the same word, but the goal of processing food for pets is to achieve complete and balanced nutrition. The other goal of processed food for therapeutic or prescription foods is to achieve a highly controlled nutritional profile to manage those diseases for whatever it's designed for. So that processing essentially assures that we're meeting all their nutrients in each and every bite of very high quality. So when we select high quality prescription foods, that processing is with exceptional precision and accuracy so that each batch, lot to lot to lot, has undergone multiple quality control tests, controlling it down to the exact gram or milligram of specific nutrients. Again, food be thy medicine. You wouldn't want a large variation. We want to control those nutrients so they can do the job of managing diseases. I just made this little figure to give you a smattering or an example of all the marvelous ways that we can use nutrition to treat diseases. We have prescription products to help with brain function, to help delay or treat dementia or canine cognitive dysfunction. We have some nutrients that can help diminish seizures, treating diabetes, a whole host of gastrointestinal diseases, so diarrhea and vomiting, inflammatory bowel disease, cardiac disease, kidney disease, obesity, arthritis, skin diseases and allergies, urinary tract conditions such as urinary stones. And this is probably not a complete list, but these are the main diseases and conditions for which we have prescription products. So the purpose of a therapeutic or prescription diet is to achieve these nutritional goals, to provide the nutritional requirements for that particular species at that particular life stage, at that particular health. And so we identify what I call nutrients of concern. If there is a condition like pancreatitis that requires very low fat, that would be a nutrient of concern. Some conditions need enrichment of certain nutrients. And so those are what am I going to modify to make this formula? If I like to say, if I were king, meaning if I get my way, each and every time you get a prescription product for your pet, it should come with very specific feeding instructions, the exact title of the food, because they're very confusing names, an exact amount, and a feeding directions. The other piece that I want to really highlight is these are prescription products. And every time we write a prescription for these products, we will also give a monitoring plan or a follow-up plan. I know there are lots of questions on, can you feed these prescription diets long-term? And the answer is, it depends. It depends on the pet. It depends on the condition and the disease and the progression. Many are meant to be fed long-term, but not without careful monitoring. And that's why we require a prescription and a renewal of that prescription. They're not just meant to be dispensed and go on autopilot. I'm going to just also address some of the challenges I know that you face and some of the challenges that I hear about each and every day when I'm seeing my patients, because I know that these bring about some challenges. I know that these foods are thought to be very expensive. They are expensive, again, because of a lot of the science that goes into it, the high degree of quality control. It's more expensive to control down those nutrients to the gram or the milligram and make sure that it doesn't vary batch to batch to batch. It's sometimes less convenient because these do require a prescription. Again, the goal for that is that there's veterinary oversight. We're making sure that we're seeing the response that we want, or else we'll make a modification. There's a perception of palatability, or that these foods taste yucky. And I think that's not always true. What I know is that when our pet gets a diagnosis with a disease, there's a natural grieving process. There's a loss and a worry and concern. And then taking away some variability and having to control their diet gives us this sense of loss. And so we have ways of making sure that these diets are palatable and well accepted. And I'll mention some of those tips and tricks. And I want you to not think of it as deprivation, but a way of treating and managing and helping them feel better. I know it's tricky when there's multiple pets in the household. I want to also say that therapeutic diets or prescription diets are not necessarily meant to be fed to everybody in the house. I know that can be challenging, but my example is if I have one of my children who gets diagnosed with diabetes, everyone in the house will not get insulin. And so I'm happy to help, and I hope your vet care team is, to think of ways to make it easier to feed these pets that need a prescription diet, to feed them separately so they get the food they need and deserve. And so that food wouldn't harm a pet that doesn't need it. And again, I see great value in these foods, and so I'm a big proponent. I won't take a deep dive in lots of diseases, but I'm going to use the therapeutic kidney diets as an example of what our goal is, or how we use therapeutic diets to treat disease. If you have a pet with kidney disease, thank goodness there are different therapeutic diets, because nutrition is the mainstay of therapy in slowing the progression of this disease and in treating diseases. We choose not only protein, but fats to make sure that there's essential fats, the carbohydrates, phosphorus is limited, calcium is controlled. So this whole laundry list of things, it may just look like a can or a bag, but each and every one of these features is modified. Kidney disease patients have increased thirst and urination, so they're losing their water-soluble vitamins. The kidney diets enrich those. They add in antioxidants to, again, many things are aimed at slowing the progression of the disease and helping these pets feel better. So another, again, goal and hope and dream of mine is that you will walk away, if your pet has a prescription diet, with an exact feeding instructions. And if you don't get that or understand it clearly, please ask the healthcare team, because it's so critical that we feed the right amount to make sure that the pet gets the nutrient modifications to manage the disease. Here's my example, again, not to endorse anyone in particular, but to use these as examples. If my dog were eating this product, the Beneful product, and his dose is 1 cup a day, so half a cup twice a day, he was diagnosed with kidney disease. And luckily, there is a whole host of kidney products available. Depending on which one you would have prescribed for your pet, just an example here, my regular food is about 300 calories per cup, but the first kidney diet is 365 calories. The next one is 420 calories. And the third one is 478 calories per cup. So again, if you're feeding diet A or have that prescribed, you would need only to feed 15% less than the normal diet, the healthy diet that he was previously on, in order to maintain that healthy weight. If he gets any of these other higher calorie products, it would be 25 or 35% less. So a tendency that I see is you get a new food and you just feed the same amount as your old food. And that might not be the right thing to do with these prescription products, because calories will vary cup to cup, product to product. So like I say, if I were king, I'm a big fan of having pet parents use gram scales to measure. At the very least, we're going to give a recommendation with a cup measurement, but my strong preference is to use grams. Measure it once a day. We know that's much more accurate, and then just divide that amount of food throughout the number of meals that you want. Because we know hand in hand with managing diseases, we want to support healthy body weight and body condition. And so I've gone over this in my previous series, so I won't belabor it, but I've given a QR code if you want more details on what health feels like. We should be able to feel individual ribs very easily, like it feels like the back of your hand. Without turning your fingers in, you should be able to lightly feel along in the direction of nose to tail, the healthy rib cage, and there should be a nice waistline. So again, our goal is to support that healthy weight while we're managing those diseases. And so intake is so key, because those products are balanced to calories. I'm just going to give an example that will probably make intuitive sense to you. These were 200 dogs that were in a colony, and we measured, I didn't, but the researchers measured their actual calorie intake per day. And it probably won't surprise you, there's a wide variation. When I do a calculation on how much your dog needs, or your cat needs, it will give sort of the average. But we know that we're all human. And so in theory, we need 2,000 calories. And that isn't even remotely close to the truth. In my advancing age, I need far less than 2,000 calories. And we see as dogs age, as cats and dogs become neutered, their energy requirement varies dramatically. And so there's so much individual variation. Knowing what your pet eats at their healthy weight tells me what their individual metabolic rate is. When I know that, I match the rest of their nutrients based on their intake. I'll give another example. If I have one dog that needs a whole can of food and another dog the same size, 2 Labradors, but that Labrador has a lower metabolic rate and needs much less. If I want to use a supplement, like a joint supplement, I call them these magic crystals, and the therapeutic dose of these magic crystals is 12 a day. Well, this dog, dog A that eats the whole can, will get the full dose. But I also want to maintain healthy weight, and dog B requires far less calories. If I want to use this therapeutic product, I would need to then add a supplement, because he'll only be getting half of his dose. Another option would be to pick a different product that has a higher concentration of those supplements in it. I have to give a little primer on pets that are overweight or obese, because what we know in our country, that 60% of our dogs and cats in the United States are overweight or obese. So we know that this is an epidemic. And when I say obesity, that means 30% above their healthy ideal weight. What we know is that at 20% above their healthy lean, they would very likely require a therapeutic weight loss diet in order to meet their nutritional needs. And so if your inclination to help your dog just lose some weight, check with your veterinary healthcare team. If they're 20% above their ideal, just cutting back on the amount of food runs the risk of nutritional deficiencies. So going back to that example again, if you need 10 of these stars that are all the vitamins and minerals, and if my pet is normally eating this full amount, this 1 can, they're meeting all of their needs. But if they're overweight and I'm trying to help them lose weight, just cutting back will definitely cut back the calories. But look, it also reduces the vitamins and minerals that are so essential to maintaining health. So just cutting back is not necessarily the healthiest way to help your pet lose weight. All right, let me make sure I'm keeping on task and on time. And I want to just run through some tips for success and some pitfalls to avoid. I know that when your pet receives a diagnosis of a disease and a prescription diet is recommended, my big advice is patience pays off. Make sure that you do a gradual transition. Ask the healthcare team for a transition. This is not an urgency or an emergency. It's better to invest in time to let your pet acclimate. If you think about a human that gets diagnosed with hypertension and your doc says, cut out the salt. If you ate a very high salty diet and then you cut it down immediately, food tastes terrible. It tastes like styrofoam. But if you do a gradual acclimation, pretty soon you go, if you went back to that high salt diet, you go, oh my gosh, how did I ever eat that? So patience and slow transition pays off to let that pet acclimate to the new modifications. We never or try never to start a new diet when a pet is feeling ill or nauseated, or they'll become averse to that. If you've had the stomach flu and you get really nauseated or vomit, you don't want that food ever again. And so we never start a new diet. We might use a sacrificial product that's halfway to the nutrients that we want. Or I am very liberal with anti-nausea medications or appetite stimulants so that acclimation can be acquired. Ask your vet care team about these medications to ease signs, clinical signs of nausea, or to help boost appetite as you're making those changes. I field a lot of questions too, just like that word processed. What about those ingredients? I look at this prescription food and I don't like the ingredients. They have all these chemicals in them. They really aren't. They are chemicals, but it's literally the formal name for vitamins and minerals. So pantothenic acid sounds really kind of unfriendly, but it's just a B vitamin. And so the companies that are making prescription diets use the very formal name. So if you have questions about that ingredient list, ask your healthcare team. Each and every one of those ingredients is in there for a reason, and it serves a purpose to alleviate progression or clinical signs of that disease. Again, I know how valuable treats are. They're so important for our pets. And also we need to make sure that I give you an option for treats, but also we don't undermine the benefit of that diet. And so I'm not going to belabor this, but remember, ask your team to help you determine what 5% is. And that's anything that's coming from unbalanced treats. But when we're using prescription diets, we want to make extra attention to what the needs of that disease are. I'll use my example of kidney disease. We want to make sure that we don't have too much phosphorus. So cheese is beloved by many dogs and cats, and cheese is extremely high in phosphorus. So we don't want to add foods that will interfere with the therapeutic goals of treating that disease. So again, kidney disease, adding extra dairy and meat to get them to eat the kidney diet is not the way to go. I often can find ways to give treats, but I can find ways to help make those foods more palatable, like warming them up. Sometimes we can add flavors. My favorite way of giving treats is to get liquid smoke and put one little drop on a cotton ball, get a little bit of their prescription food and put it in a jar with the cotton ball. So the smoke doesn't go on the food. It just stinkifies that prescription food. And that's a way of giving it many more flavors. And I can then use those as treats. And then that's just part of their regular diet. I want to call out the caution of things that are freeze dried or dehydrated. like freeze-dried liver treats or bully sticks or pizzle sticks, because we know that anything that's freeze-dried or dehydrated, consider that to be raw, and that can contain harmful bacteria. I have a research colleague who studied bully sticks. She did a research project, and over a third of those were contaminated with some seriously harmful bacteria. So especially for our pets, I don't recommend them for any pets, but especially not the old, the young, or those with disease. We know that many pets can eat them and nothing bad happens, but it's literally like rolling the dice and taking risk. And I know you don't want to do that with our beloved pets, especially those that have special needs. And so treats are so important, but I want to just remember that time with your pet is just as much a treat. We love to feed, and you're talking to a nutritionist, right? I love feeding more than anything, but time with them is also a treat. Taking them for a walk, whatever it is that they love, that is also an extra treat. And so there's so many other things to consider in addition to treats, so you don't have to feel we're depriving our beloved pets, our fur kids, if you will. So many creative ways. Offering foods in puzzles for cats makes it extra tasty and lovely and wonderful. And so lots of ideas. I also know how important when our pets are eating a therapeutic food, they're very often also needing some medications. And so that can be really, really stressful. Talk to your team to find great ways to medicate them. Ask them to prioritize. If I can only get a certain number in, what are the most important? And this is where I'll prioritize needed medications over supplements. So I'll literally help clients make a priority list, because we don't want the act of giving those things more stressful than and undoing the quality of life. But there's all sorts of great ways to get creative and to troubleshoot and to think of different food forms, and making sure that whatever vehicle we give doesn't, again, impact the nutritional goals of the food. And remember that pets follow our cues, especially our dog friends. They read our faces, they read our cues. And so again, that diagnosis represents grief to us. And so if we approach this therapeutic food, this prescription diet, thinking in our head that it's yucky, our dogs and cats will pick up those cues from us. And so I'm going to ask you, I love this picture because it's on a cloudy day. It's a way of reframing. And so I don't see those foods as restrictive or deprivation. I see these therapeutic foods as an opportunity, a possibility, a hopeful sign that we can help these pets live longer and healthier during the course of their disease. And sometimes they will not eat the food that is available commercially, but talk to your team, because there's lots of troubleshooting ideas. Sometimes, and a big part of my practice is to help pet parents cook for their dog. Cooking prescription diets is not necessarily better, and I'll usually try to find a commercially available food, because those manufacturers that are making therapeutic diets are strictly controlling nutrients down to the milligrams and grams. And that making food at home requires distinct accuracy, and it requires a recipe by a board certified veterinary nutritionist. Do not look for recipes online or even in books for sick patient recipes. Most of those are unbalanced. In the course of my decades of working, when someone finds a recipe online or from other sources other than a veterinary nutritionist, 100% of those had nutritional deficiencies, excesses, or sometimes both. And I know full well the goal of cooking for your pet is to do the very best. So let someone who knows how to formulate do that for you. So just some cautionary tales, what to beware of or be aware of. Again, I worry very much about therapeutic or prescription diets that don't require a prescription from a veterinarian. So if you're finding something online that doesn't require a prescription, it is not a therapeutic diet. Please don't use recipes for sick patients without the help of someone who is a veterinarian, can manage diseases, and knows how to formulate recipes. And remember, whether it's homemade or prescription, all of these patients need regular follow-up so that we can make sure and follow the course of disease and make modifications as we need to. Don't despair, but be aware. We want follow-up. We want to help you troubleshoot. If you get home and those instructions weren't clear, you don't know how to feed, follow up, ask questions, email. We always expect emails or to check in within that first week so that we can help troubleshoot some of the problems before they get too bad and they don't want to eat that food. Again, you're a very valuable member of our team because we're making the recommendations, but you're the ones in the trenches feeding and helping to nurture your pet. So we want to be part of that team and help you through this process. I know some of the questions too, as I finish up here. I'm hungry for more. Many of you were interested in more information about how to pick pet foods, and that's in one of the earlier parts of the series. And also, what are some great, credible resources? I love, love, love these two handouts. I give them out almost to every client at every visit. The World Small Animal Veterinary Association has this lovely handout on the criteria for selecting pet foods. These are the criteria that I use when evaluating a pet food manufacturer. And that is, do they have a board certified veterinary nutritionist or someone with a PhD in nutrition? So someone who understands health and disease and nutrition of your pet, and they should work full time. Again, these foods are meant to be the mainstay each and every bite, so that you should have someone with high education and credentials helping with that. They should have quality control standards. They should be able to answer questions about their quality control, and they should have traceability and accountability. So if there's any problems or questions, I can call them. I can ask about the nutrient composition. I can ask about where that food, if I give them a lot number, they can tell me where it was sold. And so excellent. There are excellent products out there. And the QR code to that handout is right here. The next one is, it's a jungle out there looking for information on the internet. And so there's a savvy cat owner as well as a savvy dog owner's guide to nutrition on the internet. It helps you search for credible, reliable resources. And then my, not my last, but another favorite of mine is pet foodology. My colleagues, my nutrition colleagues at Tufts University, they have a few more nutritionists on staff there. And so they create a blog that, again, completely non-branded. It doesn't receive any industry funding. And they have excellent, excellent resources. And you can subscribe to that and get a newsletter with wonderful, wonderful, credible nutrition information for your pets. I think I'm on time, and I wanted to thank you all for your attention and your lovely questions that spurred ideas for me to create this webinar. And I want to leave time to open it up for questions. Thank you so, so very much.
Thank you, Julie. That was really insightful and informative. Thank you so much for that presentation. Now we'll begin the Q&A. So some questions in advance were addressed in the previous 2 nutrition webinars, and we will include a link to both of those recordings in a follow-up email to all registrants from tonight. So we'll jump into the questions about tonight's themes. So in looking at all of the great pre-submitted questions, there were many questions submitted about cancer, preventing cancer and treating cancer through nutrition. So Julie, could you talk a little bit about preventing cancer in both cats and dogs with nutrition?
Yes, this is a topic near and dear to my heart because I am married, some of you know, to an oncologist who works here at the VMC, Dr. Mike Henson, and my best friend. So if we could prevent cancer completely, I could quit my day job and retire immediately. But really, there are many things that we can do, and that is to keep our pets as healthy and robust as possible. And so that's why I said the cornerstone of nutrition is a really solid foundation, making sure preventive and proactive care. We change the foods at every life stage. So they're eating a growth food during those growing formative years. We're keeping them healthy at an ideal body weight and body condition, and that they're meeting all of their needs so that they can have the most robust immune system. The environment and exposure and age, it's really just a normal cell in our body that runs amok. And so that is happening all the time. And what we want to do is make sure our body is absolutely as healthy as possible, because we're knocking out those cells each and every day. Once a pet has a diagnosis of cancer, I think that was another question, then it's a little different story. And so again, my approach is very similar to what I've sort of already shared. The foundation of that health is to provide all the nutrients that pet needs. And then we do that individual assessment on what is that pet's individual health. Cancer is not cancer is not cancer. Different cancers affect different body systems. And so what I want to do is first and foremost support healthy immune function, support healthy body weight, and then I modify nutrients depending on the cancer it is. Some will thrive with different essential fatty acids or supplements, but I usually try to find a food that addresses the whole body so that they are best armed at defeating the cancer, in addition to either chemotherapy, surgery, or radiation.
Thanks, Julie. That's great. Another bucket of questions that came in from the registrants was all about allergies. So similar in the same vein, could you talk a little bit about how you approach your therapeutic nutrition when the question is prevention of allergies, and then as well treatment?
Yeah. So prevention is a little tricky. Allergies are so extremely common. That's the bad news. They are seemingly increasingly more common in both our dog and our cat population, but the most prevalent is environmental allergies. So allergies to dusts and molds and bugs, and very uncommonly, and this is counter to what the popular belief is, food allergies are actually very uncommon. That's good news for me. And so again, I want to support healthy lifestyle, healthy body function with the same way I would sort of with cancer. I want to provide all the nutrients that they need. And then there are great diets that help support skin barrier. They're going to be enriched, and that's where I'm sort of up here in the nutrients of concern. So even dogs that have environmental allergies or cats that have environmental allergies, we can tweak the nutrient composition to help increase the external skin defense, and then help against itchiness. So there are supplements that can be incorporated into the foods, like fish oils, that can have it sort of some anti-itching properties. Food allergies is a smaller component, and so that requires a diagnosis. Most of the time, like I said, thankfully, food allergies are very uncommon, but the belief is that they're very common because there are so many foods on the market that are tailored to limited ingredients or limited, they call them antigens or single source protein. That is a way that we treat food allergies, by doing an elimination trial. So we find something new or novel that that individual body has never seen before. We feed that food and only that food for about 8 weeks until the signs go away. And then we challenge with the original food, and that confirms a food allergy. Most of the food allergic patients that come to me because they have food allergy and another condition. Thankfully, over 95% of the patients that come to me with the presumed food allergy, we can disprove it. And that actually it sort of frees things up, because they're It's not as common as possible, but it's often believed by something in their life, they had an adverse reaction. So you feed a new food, they get diarrhea or they start itching. And it's a natural assumption that that food caused it. Probably some other underlying thing caused it, and they might be able to use other foods. So my biggest job is disproving food allergies. And thankfully I get to do that a lot. And so it's the very small subset that we have to treat with a very strict prescribed food with a single unique source of protein or a very special high-tech protein called hydrolyzed protein. So we can't really prevent allergies, either environmental or food. If I could give any little bit of advice, it would be not to expose your dog to or cat to many proteins throughout life. Should your pet be the one that does have food allergies, I then have very few options.
Thanks, Julie. Appreciate that. It's on your slide here, but we did have a set of questions come in about arthritis in cats and dogs. Do cats and dogs get rheumatoid arthritis, and is nutrition involved in treatment of that?
Yeah, they don't get the classic rheumatoid arthritis like humans do. There are immune-mediated arthritis, and their nutrition of that would be just supportive care. That would require medical management for immune-mediated arthritis. Arthritis in general is associated with the longer we live, generally, the more severe arthritis becomes. But I have good news. We can dramatically prevent the onset or slow the onset and slow the progression of arthritis by, guess what? Feeding the food correctly. So keeping our pets healthy, lean. People always want to know what is the best food. It's not just the best food, it's feeding the food right. And that is to keep them healthy, lean throughout life. They'll live longer and they'll have a much lower incidence and severity of arthritis.
That's really great. Thanks, Julie. Looks like you also saw some of the pre-submitted questions, and you did touch briefly on the role of treating kidney disease with nutrition. Could you talk a little bit more about how nutrition and your approach can help?
Yeah,
preventing kidney disease?
I sped through that because I was worried about timing and I wanted to leave time for these questions. And there were quite a number about kidney disease because it's still a little bit of a mystery. I think because I showed that slide with all of those different nutrient modifications. Some things are enriched, some things are decreased. And so it's a very complex composite of nutrient modification. But healthcare teams frequently say, well, it's a low protein diet. It's not necessarily a low protein diet. It's a modified, it's really a diet to avoid excess protein because we want to find, I call it Goldilocks. We want to find the level of protein that's just right so that we meet the whole pet's needs, but don't exceed it. That excess amount of protein will provide phosphorus. Phosphorus is the main nutrient that we all agree on that promotes progressive damage to the kidneys. And so we want to highly control or restrict phosphorus. And that's kind of academic. We do that largely through a very careful selection of protein type to make sure it has the exact amino acids. So to the can, if you're looking at the can or a bag, it seems really simple, but it's very complicated in the nutritional composition. We also want to avoid excess salt because high blood pressure is another phenomenon that happens with kidney disease. We want to enrich it in omega-3 or fish oils because that is sort of anti-inflammatory and it has healthful properties for kidneys. And we want to enrich a lot of the water-soluble vitamins. So it's many things. But we want to make sure that our kidney patients have lots of water, fresh access to water so that they can compensate. They're peeing a lot, so we want to make sure water's available and they're well hydrated. And then we want to make sure if we can get them to eat the right thing, they will feel better for longer.
Great. Thanks, Julie. We're getting towards the end of pre-submitted questions. There was one more bucket, and we have some more that came in during the Q&A and in the chat. There's just you touched on this as well with some of your really go-to and preferred sources for education of pet owners who want to find more information in their own research. Are there any other resources that you haven't mentioned that you might recommend for people looking to learn more about companion animal nutrition other than those you mentioned?
Yeah, well, my answer is always your healthcare team. I'm always going to send you back to your veterinarian because that's my hope and dream, that the veterinary healthcare team, and don't forget our wonderful technicians. I work with the world's best nutrition technician, and so we can answer so many of your questions. I highly recommend, again, I'm going to summarize a shameless pitch to go back to those other 2 webinars. I hope that would answer a lot of the questions. And then Pet Foodology will be, it's so user-friendly, it's client language, it's not complicated, but it's incredibly educational.
Great, thanks, Julie. Now, there are some that came in through the chat that we would like to address as well.
Yeah, sure.
One came up, someone was asking about, are there any additional nutritional needs or concerns for performance dogs, such as racing or coursing dogs? Is that anything you can speak on?
Yeah, sure. So every time that a body needs to be used for something to a function, like police dogs and performance dogs, we alter the nutritional composition. I want to make sure that I'm meeting all of their needs. So depending on the type of performance, agility dogs actually don't need a lot more energy. And so we want to keep them healthy, lean to, again, maintain their healthy joints and arthritis. The ones that work out in the cold or energy needs are related to the amount of distance they go, not speed. And so it's really the amount of distance. So those that are hunting and on the go for hours and hours and hours on end in cold environments, they need a lot more energy. And some of those dogs, when they're on the job, whether they're hunting or whether they're doing their agility, their appetite will sometimes decline because they would rather hunt than eat. And so I have to find a food that's packed with nutrients, higher in calories, higher in fat, to get them to, they won't have to eat the biggest volume. And so making sure they're hydrated and then meeting the energy needs of their expenditure. So it's not just one size fits all. I hope you're getting the gist. It's individualized nutrition.
Thanks, Julie. Another question submitted tonight is, do you have any tips for diet or nutrition recommendations to improve a pet's sleep, quality of sleep?
Yeah, my first response is another question, which you won't be able to answer. And so, but when I hear about sleep disturbance, if it's an elder pet, very often it's because they might be having some signs of cognitive decline. That's one of the first signs is abnormal sleep-wake cycle. And so there are nutrients that can help with that. There are some newer diets on the market for aging brains that have a medium chain triglyceride or a very special type of fat. And that might be one thing. So really it would be an assessment of that individual, like why are they not sleeping? I would want to do a good physical exam and making sure pain can also impair sleep. So making sure there's no physical abnormalities, no organ abnormalities. And then cognitive dysfunction is really almost one of exclusion. You rule everything else out. And then some of these products have made a big difference.
Great, thanks. Next question is about the role of fruits and vegetables in a balanced diet for a pet. Could you speak about the role of those?
Well, we all should eat more fruits and vegetables. Well, we know that. I use a lot of fruits and vegetables because they're very low calorie. So if we're using a high quality food, they don't need anything else. Remember that complete and balanced, but it's just darn fun to feed our pets. And so if I have only that 5 or 10% budget, fruits and vegetables are a great way to give bigger volume of food and snacks. So again, my dogs, they think a broccoli stalk is a bone, and they just love it. Not all dogs love fruits and vegetables, but again, it's that acclimation period. I adopted some reservation rescue dogs, and they sure didn't think veggies were a good idea in the beginning, and now it just rocks their world. So patience and finding, but we still want to give it in moderation and track the calories so your healthcare team can determine how many blueberries this pet will get. It's not unlimited, free for all.
Thanks. We have time for maybe one or two more questions.
Okay.
We'll try to add those in here. The next one is about, in your view, are there any concerns or things to consider about having a pet be on a prescription diet long term or for a long time?
That's a wonderful question. Thanks for asking that. It is right to ask and to be concerned. And the answer, again, it depends. It should never, your pet should never go without monitoring. At a minimum, twice a year if they're on a prescription product. Most of the prescription products now are meant for long term. There were some very unique diets and that were short-term treatments, and most of those are no longer available. But I don't always see the results I expect, and so then I'll make a modification. So many can be long-term, but you need to have that discussion with your healthcare team. Remember their prescription for a reason, and that prescription needs to be renewed, and the renewal means you need an assessment.